Have you noticed that getting up from a chair feels a little slower than it used to? Maybe your knees feel stiff when climbing stairs. Maybe mornings now begin with tightness instead of ease. For many adults over 40, these small changes don't happen overnight. They happen gradually. And when they do, one of the first supplements people hear about is glucosamine. It's one of the most widely used joint supplements in the United States. But here's the real question. Does glucosamine actually work? Or are people simply hoping it does? In this video, we're going to take a calm, research-based look at glucosamine. What it is, what studies suggest, how dosage matters, and whether it may be worth considering for joint support. Honest reviews, no hype, just research. What is glucosamine? Glucosamine is a naturally occurring compound found in your body, especially in cartilage, the tissue that cushions your joints. Cartilage plays an important role in smooth movement. Over time, as part of natural aging, cartilage can gradually change. That's one reason stiffness and reduced flexibility become more common after 40. Most supplements contain one of two forms: glucosamine sulfate, glucosamine hydrochloride. Among these, glucosamine sulfate has generally been studied more extensively. The theory behind supplementation is straightforward. By providing glucosamine externally, you may help support joint structure and comfort over time. But theory is one thing, evidence is another. What research suggests? Research on glucosamine has been ongoing for decades. The results are mixed, but not meaningless. Some clinical studies suggest that glucosamine sulfate may support joint comfort, particularly in individuals with mild to moderate knee stiffness. In certain trials, participants experienced gradual improvements in mobility compared to placebo groups. However, other studies show limited or no significant difference. Why the variation? Several factors may influence outcomes: type of glucosamine used, dosage levels, duration of use, severity of joint changes, overall supplement quality. One important point, glucosamine is not designed for immediate relief. If benefits occur, they tend to appear gradually, often over several weeks or months. Research suggests that consistency and formulation quality matter significantly. Dosage considerations. Dosage plays a critical role in whether glucosamine may be effective. Many studies that reported supportive results used approximately 1,500 milligrams per day of glucosamine sulfate. Lower doses may not reflect the conditions studied in clinical research. When evaluating products, consider the specific form listed on the label, whether the daily serving matches commonly studied ranges, whether additional ingredients like MSM or chondroitin are included. Underdosed supplements may lead people to conclude glucosamine doesn't work, when the issue may be formulation rather than the ingredient itself. Patience is also important. Most research evaluates use over extended periods, not short-term use. Pros of glucosamine, one of the most researched joint support ingredients. Glucosamine sulfate has long-standing clinical data, generally well tolerated by most adults, widely accessible and affordable. For many individuals, glucosamine remains a foundational joint supplement due to its long history of use. Cons of glucosamine research findings are not universally consistent. Benefits, if experienced, develop gradually. Not every form is equally studied. Supplement quality varies significantly. It's also important to emphasize glucosamine is not a cure, and it does not reverse advanced joint degeneration. Expectations should remain realistic. Who should use caution? Although glucosamine is generally considered safe for many adults, certain individuals should consult a healthcare professional before starting supplementation. This may include Individuals with shellfish allergies, those taking blood-thinning medications, individuals managing blood sugar levels, anyone with ongoing medical conditions, pregnant or nursing women. Supplement decisions should always consider personal health history, setting realistic expectations. This is where clarity matters most. Glucosamine is not an instant solution. It does not eliminate discomfort overnight. It is not a replacement for medical care. What research suggests is that glucosamine may support joint comfort gradually, particularly in mild to moderate cases, when taken consistently at appropriate dosages. Some individuals notice meaningful changes, others notice little difference. That variability is normal with nutritional supplements. Support, not miracles, is the realistic framework. Final verdict. So does glucosamine actually work? Research suggests that glucosamine sulfate may support joint comfort and mobility for some adults over 40, particularly when dosage and formulation align with studied ranges. It is not a guarantee. It is not a cure. But it could be worth considering as part of a thoughtful approach to maintaining joint health. As always, focus on quality products, behind transparent labeling, and realistic expectations. Closing. If you'd like to review ingredient details or explore well-formulated glucosamine options that align with common research standards, I've placed links in the description below. At the Joint Health Report, our mission remains simple: honest reviews, no hype, just research. If this breakdown helped clarify the topic, consider subscribing for more evidence-based joint health insights. Better decisions start with better research. If this breakdown helped clarify the topic, consider subscribing for more evidence-based joint health insights. Better decisions start with better research.